Welcome everybody to Global Leaders Local Coffee. I welcome today Dr. Joseph Barcie from UChicago Medicine. Dr. Joseph, thanks so much for being here.
Thank you very much for having me. Enjoy it.
Well, we always do, global leaders and of course, local coffee. So, would start with the question of, are you a coffee drinker? Do you have a favorite, do you have a favorite coffee story as well?
Yeah, actually I do. I am a coffee drinker, and I was very lucky in my career to have visited so many different countries. I've lived in the last 12 years, I lived in 8 different countries. I've had the pleasure of living in 2 great coffee producing countries of Costa Rica and Colombia. But today I'm actually drinking this coffee. It's an 100% Arabica bean. It comes from Costa Rica, about an hour and a half outside of San Jose. It's a family-owned farm called Doca Estates, and it's called Passion of the Heavens, which is a great name for a coffee from that place. But it's very smooth and actually tastes delicious.
That's great. That's a great story. Definitely will add that to my list of things I have to check out. I'm drinking Phil's, which is my classic filtered soul. I can't get off of it. I just love it. And I'll share with the audience too. My team sent me what is, I think, one of the funniest coffee mugs, especially for the year. I think it's the most famous words being used is you're on mute. So I don't have to say it anymore. I can just hold up the coffee cup whenever somebody is on mute.
That's a great cup.
Well, hey, let's dive into it. Obviously I'm well aware of your extensive career in healthcare, but would love it if you could share maybe with the audience a bit of your background and the places that you've kind of worked within the industry.
Well, I went to medical school to be a medical researcher, so where I am today was certainly not what I thought I would end up when I first started my career. I went to med school, like I said, to be a medical researcher. And immediately after that, I went back to school again and got an MBA in healthcare administration from the University of California at Irvine, and started hospital operations here in the United States for about half a dozen years. And then I got recruited to work internationally. And I started working internationally about 2005, 2006. Like I said, I've lived in a lot of different countries. I've had the pleasure and honor of knowing that so many different cultures and so many different organizations. And recently in 2019, I actually had the pleasure of being able to transition to the University of Chicago. So at the University of Chicago, I lead the strategy and business development for Latin America, the Caribbean, and Spain as well.
That's great. It's been a challenging year as we've also known. And so, would love to just start and say, as leaders and tech leaders in particular, we've all been trying to navigate our companies through this global pandemic. Obviously healthcare has been on the front lines as an industry. Would love to just hear, looking back on the last, about 12 months or so, how do you look, being in the industry, how do you look at the last year? You and your colleagues, I'm sure, have been on the front lines and seen all types of things. Can you share a little perspective with the audience as well?
Sure. Well, I think what the pandemic has done has accelerated the things that were already happening very slowly, naturally. The e-commerce side of business and in healthcare, telemedicine and virtual diagnostic equipment, things like that. The pandemic kind of accelerated all that. I know that before the pandemic, for example, we had very few physicians actually doing consultations with patients online or remotely, and now that's kind of standard practice. And I really don't think that genie is going to go back in the bottle after the pandemic is over. I think that people realize that they have to get in their car, navigate traffic to go see a doctor for an appointment for 15, 20 minutes, and then the hassle of getting back and driving back home when they can do it remotely. That's going to save a lot of time. Also, the pandemic has also accelerated new technologies in artificial intelligence in where areas that didn't exist before, and remote physician communications, where You have companies like Avail and others who actually have great systems that are sitting inside an operating room, and when they need a specialist, they can basically call that specialist on demand to almost be there virtually inside the operating room. So there's lots of new technologies that I think the pandemic has just accelerated their acceptance in the common practice in healthcare.
Yeah, no, we've seen so many similar trends in fintech and payments. It is that push, right? I think the word resilience we've often used to just highlight how resilient and creative some of these industries are. And I think it is one of the small silver linings. People being pushed to innovate, come up with new ways and better ways to do things when facing such adversity. Now, I know specifically you've also been involved in a lot of the COVID response and programs within Latin America. Can you talk a little bit about that? I mean, obviously here in the United States, in some of the markets in which we operate, there's very different responses happening for COVID-19, and part of the world getting out of this isn't just for one country to get out of it; it's actually for the world to truly get out of it. So. Maybe can you talk a little bit about what the work is that you've been doing and how you see the world kind of having to react to this as a unified group?
Yeah, thank you for asking. That's a good question and a good observation, actually. In Latin America, Latin America was probably 30 days behind what was happening in the U.S. In other words, what was happening in the U.S. was going to happen in Latin America 30 days from then. So the physicians in Latin America were eager to get information from the trenches of where things were going and how best to prepare in their country. So, for example, in Latin America, we were able to reach out to our current partners. University of Chicago has partnerships in Chile, Argentina, Colombia, Mexico. I mean, we have Paraguay, Uruguay, we have Peru. So we have lots of partners in healthcare, and so we were able to send them free online educational courses on how to prepare, how to treat patients with COVID. How do you treat a cancer patient with COVID? How do you treat an orthopedic patient with COVID? How do you treat a pregnant woman with COVID? How do you treat a teenager with COVID? So all these kind of online, and all of this was done virtually. So we had great responses. In just 3 months, we had over 2,200 physicians sign up and participate in online courses that the University of Chicago prepared and disseminated for free for how to treat COVID patients.
Oh, that's great. Yeah, no, it's encouraging to see such a global response and collaboration. It does give one a bit of hope, a bit of optimism when you see folks come together to unify around something so challenging as this.
Yeah.
Well, as we share, as we oftentimes try and give people a peek into leadership in different industries as part of the show, one thing I always love to ask people is, if you go back to people who knew you as a child, would they be surprised as to what you're doing? Do you look back and see trends, either that of kind of internationalization trends that, has you kind of in a role that's very global in traveling to many countries? Is there anything you can map towards your childhood that was an indicator of what you'd be doing today?
I wish I could say yes. A lot of it has to be, I think when I look back, a lot of it has to be being prepared for the opportunity and having a little bit of luck along the way. I did want to go back to the prior question for a minute, and then I'll answer this one if you don't mind.
Sure.
Because your organization actually helped us tremendously with one particular course, and it was a phenomenon that was happening around the summer of last year. A lot of the public hospitals in Latin America were short on staff. They were inundated with COVID patients, but they were short on staff. They had all the PPE equipment and ventilator equipment that they needed, but they were short on staff. So they started recruiting nurses, respiratory techs from anywhere they could find them. And the private hospitals ended up losing a lot of those employees to the government hospitals. And so there was a need to be able to train physicians, primary care physicians, intensivists, respiratory techs, nurses on acute care of COVID patients in ventilator areas in ICU. So in September, we were able to partner with the University of Chicago and our partner in Argentina. And also we had guest speakers who were ICU professionals from Chile, Colombia, Mexico, Spain, and Peru as guest speakers. And all of them together from mid-September to late October, we gave an online educational training course. And we had to rush to put that together. And at the time, we didn't have an e-commerce solution for that project. And even we were charging the cost, which was just $50 to participate, just to cover our costs. But it turned out that we didn't have an e-commerce solution. So I want to say how grateful I am to Flywire and to your team, Victoria, Napoli, and others who were incredible. Literally overnight, we were able to link the Flywire software to our software so that we can actually move this forward. And at the end of the day, at the end of October, we ended up training over 1,000 professionals in the care of COVID patients in all those countries. I mean, in 11 countries, 11 different countries.
Well, that's great. I appreciate you saying that. I mean, we spent the last year trying to do our best, right, to obviously navigate our company through what is a challenging global pandemic, but at the same time try to be as responsive as possible to our clients, right, who are truly on the front lines trying to be innovative like you all are. So I'm glad we were able to provide some small way of helping. It's great to hear.
So to go back to your question, so after medical school, I wanted to be a researcher. I was working as a researcher in biochemistry, molecular biochemistry. And during the summers, I would take the summer off and volunteer around the world as a free doctor around the world. I volunteered for the International Red Cross and things like that. And in one of those post-disaster deployments, I happened to meet a hospital administrator who was also there. And he saw me put together a blood bank, trained the nurses how to do type and cross matches, got equipment donated, and trained some of the personnel to do those transfusions. And he said, Joseph, why didn't you consider hospital administration? And I said, what's that? So he convinced me to go back to school. I didn't want to, reluctantly, but I realized he was right. I couldn't read a financial statement to save my life. So I went back to school, and I'm glad that he convinced me, and it really did turn the corner for me and really navigated my career into the operations and business side of healthcare.
And one thing I always find fascinating in leadership, especially for those that have crossed borders to lead, like obviously you have, and anything you can share with the audience about leadership in different parts of the world, right? In different types of people that you're leading. I always find that as a fascinating, challenge that a lot of leaders struggle with.
One of the things that I found, unfortunately, is leaders who create a punitive culture in their organization, and those organizations end up at the end of the day suffering for it. Bad news never gets to the boss, and that's the opposite of what should happen. The leaders should always be exactly informed of what's going on, good or bad. Right? And other leaders that I've come across who I admire and I consider my mentors are leaders who inspire people to go above and beyond. They hire the very best people, even smarter than they are. They surround themselves with very talented individuals and give them all the tools they need, and are there to support them. And at the end of the day, when you see those organizations, those are the organizations that actually thrive.
Yeah, for sure. No, well, very well said. I oftentimes will see organizations that are struggling and leaders that are struggling, and so many times it is also the culture or the flow of information. that, you know, is at that root cause, right? And if you've gotten to that point where the information isn't flowing, things aren't open, things aren't transparent, you know, it's really hard to make decisions and to lead people in those environments. So couldn't agree more. Well, hey, last question for me. You know, a little bit of hope, a little bit of optimism. You know, it's been a hard year for many people. You know, obviously around the world as we navigate the COVID-19 pandemic. You know, do you have something you're looking forward to? You know, I won't say going back to normal for the world, but you know, that new normal at least. You know, is there some trip you want to make, some restaurant you want to visit that you've been unable to visit? You know, what's that little light at the end of the tunnel for you?
Well, for me, it would have to be visiting my family back in Spain. I miss them dearly. I lost my mom and my dad in 2020. It's been a difficult year. So I would love to be able to go back. I know that sooner or later this pandemic will be over. We may be wearing masks for a little while. We may be getting vaccines routinely thereafter. But this pandemic sooner or later will end, and I'm looking forward to seeing my family back in Spain.
That's great. Well, family reunions definitely on the top of that list. I'm sure for many other people watching. And you know, I'll just finish and say thank you for joining us, Global Leaders Local Coffee, and thank everybody. There'll be, you know, feel free to comment, you know, post on the thread, and Joseph and I will be happy to respond to questions.
Thank you very much for having me, Mike.